Across hospitals in India, there's a moment of truth that happens long before any treatment begins. It all comes down to a single question. It's a question that for years has been the source of delays, frustration, and a mountain of manual work. In this explainer, we're going to look at how a new piece of national digital infrastructure is finally providing a clear, instant answer. You know the scene? You're at the hospital reception, worried and anxious. But before you can even begin to talk about care, this is the question that everything hinges on. For the patient and their family, it's a moment of real uncertainty. Will their policy cover this?
And behind the desk, well, it's a kind of controlled chaos. You have staff scribbling policy numbers on notepads, making calls to far-off call centers, and of course, listening to a lot of hold music. All of the critical details are exchanged verbally. It's like a game of telephone where one small mistake can mean hours of follow-up calls just to set things right.
Now, on the surface, this might just seem like a minor administrative headache, but in reality, this one single manual step creates a massive ripple effect of inefficiency that slows down the entire healthcare system.
Let's look at what those ripples are. First, and most critically, patient care is delayed. You can't confidently begin treatment until the financial side is clear. Second, it puts a huge administrative load on hospital staff, pulling them away from actual patient care. Third, it creates a serious financial risk for the hospital if a claim is rejected later. And finally, for the patient, it's just a stressful and frustrating way to begin their care journey.
So what you end up with is a system under constant strain. A system where highly trained staff are forced to spend more time on paperwork and phone calls than on the very people they are there to help. This constant risk of miscommunication, which can lead to claims being denied weeks down the line, puts a huge amount of friction on everyone.
This is precisely the problem that the National Health Claim Exchange, or NHCX, was designed to solve. Now, it's very important to understand that NHCX is not a new application or a piece of software you buy. Think of it more as a foundational digital coordination layer for the whole system. This definition really gets to the heart of it. NHCX acts like a national digital postal service. It doesn't open the letter or store the information inside. Its only job is to read the digital address and make sure that a secure, encrypted message gets from the right hospital to the right insurer, and that the reply gets back instantly and reliably. And it's all built on three very simple but powerful principles. First, standardization, which gives every hospital and insurer a common digital language. Second, trust, which is guaranteed through secure, encrypted communication. And third, interoperability, which allows the hospital's software to finally talk to the insurer's software. And that's the key, you see. The problem was never a lack of digital systems. It was the lack of a shared, trusted way for them to connect.
Okay, so what does this new digital handshake actually look like at the front desk? Let's walk through the new flow for checking eligibility, which literally transforms a process that took hours into one that takes just moments.
The contrast is just night and day. On the left, you have the old world of phone calls, verbal exchanges, long waits, and a very high risk of error. And on the right, the new way, a single, standard digital query, secure data exchange, a response in moments, and a clear, digital confirmation that everyone can rely on.
So let's break it down. Step 1. The hospital's existing system sends out a standard digital request. Step 2. NHCX, our smart postal service, securely routes that request to the correct insurer. Step 3. The insurer's system can now process this request automatically and send back a response. And finally, Step 4. The hospital receives that response as an encrypted digital confirmation. Simple.
And here is the real game changer. The staff at the front desk don't have to wait on the line or keep checking for an answer. They send the request and can immediately get back to attending to the patient. The system simply notifies them the moment the insurer's response arrives.
So, we've seen how it works. But now let's look at that positive ripple effect, because digitizing this one fundamental step creates some really profound benefits that spread across the entire healthcare ecosystem.
You see, when you solve the very first and most frequent point of friction in a process, you end up creating big advantages for every single person and organization involved.
For hospitals, the benefits are felt right away. That bottleneck at the front desk is cleared, which frees up staff to focus on what matters, the patients. And by getting eligibility confirmed up front, it massively reduces claim rejections later on, which is a huge boost for the hospital's financial stability.
Insurers and TPAs see a similar transformation. The constant flood of phone calls is replaced by clean, machine-readable data.
This means they can automate their response systems, which frees up their expert staff to handle more complex cases. Plus, better data helps them improve things like fraud detection.
But of course, the most important impact is for the patient. That initial anxiety and guesswork are gone. They get clear, reliable information about their coverage from the very start, which means no surprise bills later. And most importantly of all, their care can begin without unnecessary delays.
And that's the big picture here. By solving this first simple check, NHCX is essentially laying down the digital rails for the entire claims journey. Once a hospital and an insurer are connected through this secure channel, that same connection can be used for everything that comes next, from pre-authorization all the way to final settlement.
But, as is often the case, solving one big problem reveals the next critical question we need to ask about our healthcare ecosystem.
Because digitizing eligibility, as foundational as it is really only the first step. It builds the platform for change, but it also shines a light on deeper, more complex challenges that have been part of this system for a long, long time.
And this leaves us with a fascinating question to consider. We know that both hospitals and insurers had their own digital systems for years. So why did these problems of communication and delay persist for so long? Why did it take a national-level platform like NHCXC to finally get them to talk to each other? That's a puzzle we'll explore in our next